AMTAS is an automated method for obtaining a diagnostic pure tone audiogram, including air and bone conduction thresholds with masking in the non-test ear. It is a single interval, yes-no psychophysical procedure with feedback. In other words, the patient interacts with the software and the software makes decisions on the next step based on the patient's response. During the test, the patient will see a screen that displays "Listen for a tone," and then the screen will change to "Did you hear a tone?" and they must indicate yes or no by touching the screen. Catch trials where the software says "Listen for a tone," but no tone is presented are placed randomly throughout the test. The patient may see feedback screens. For example, if they respond yes to a catch trial, a message will be displayed that informs the patient they selected yes when there was no tone presented and to please listen carefully. If the patient does not respond for 22 seconds, a message will be displayed to prompt the patient to proceed. On each one of the feedback screens, the patient must press continue to proceed with the test. Speech testing is a single interval forced choice procedure. The software will display "Listen for a word" and then display a screen that says "What word did you hear?" The patient must choose a word to move the test forward.